The White House says individual states are responsible for coming up with their own reopening plans and that governors should decide whether people should wear masks in public. In a briefing Wednesday, White House Press Secretary Kayleigh McEnany called Americans warriors for following social distancing guidelines. Let's go ahead and bring in our CBS News reporter, Natalie Brand, who joins us now. Natalie, this is the press secretary's one of the first briefings that she's had. We saw her for the first time in the briefing room last week. What is your sense of what we heard from her today?
Well, what she started with is the increase in testing, touting 7.5 million coronavirus tests conducted, even showing a chart. Want to make clear that is still a little more than 2% of the U.S. population. But of course, this is a significant step from where we were weeks ago, and something that state and local leaders have said remains critical to reopening and getting back to normal. McEnany was also asked about reopening plans and said that states have more than 40 states, we've learned this week, have submitted formal reopening plans, but she mentioned that states have also made clear what they require in terms of supplies to complete more testing and really get testing up to speed state by state. If you go to the CDC website, even this week, they are still saying although supplies of tests are increasing, it may still be difficult to find a place to get tested. So this shows you, even though the White House is billing this as continued success on this front, it does remain an issue nationwide. Another big question that was asked and a big headline today at the White House is the coronavirus task force, because just about 24 hours ago, the vice president and then president confirmed reports that they were talking about winding down the task force and keeping the experts on the issue of the coronavirus, addressing the coronavirus, but winding down the work of the larger task force. Well, today that has changed. The president now saying that it will continue indefinitely, that he didn't realize how popular the task force is, and that well-respected people called him and advised him to keep it going. He also mentioned that 2 to 3 people could be added, a couple others could be subtracted depending on the needs and the shifting focus to safely reopening the question. Now, during this briefing, it was asked whose decision was it to wind down the task force, and that question was not answered. Last thing that caught my ear, the question was posed, why was Dr. Anthony Fauci blocked from testifying before a House committee that held a hearing today on the coronavirus federal response? And Kayleigh McEnany did note that Fauci will be testifying next week before a Senate panel, but she claims that the House committee did not act in good faith because they could not give the White House information about the subject matter and specifics on what this hearing was about. We'll have to check in with the House to get their response. Notable that both the lead Democrats and Republican on that committee did express today a desire to hear from Dr. Fauci, stressing that their work on those committees is bipartisan. Elaine?
Right, some really important context there. Natalie Brand, thank you very much, Natalie. And Meridith McGraw joins me now. She is a White House reporter for Politico. Meridith, thanks very much for being with us. Let's start with the task force. Why is the administration making changes to the coronavirus task force now?
Well, just over the past 24 hours, we've seen a real shift from the White House on the task force and whether or not it's going to be winding down. Just yesterday, Vice President Pence said that their hope was that it would slow down. And we have seen that the task force has been meeting with less regularity, although there was a meeting that they had today. But then just today in the Oval Office, the president said that he still plans to keep the task force going. Dr. Birx and Dr. Fauci will still be involved. There's going to be a new emphasis on therapeutics and vaccines. And he even said that they might add 2 or 3 additional people to that task force. But the White House really wants to change the focus now to reopening the economy and to getting businesses back and running again as they see really the economic distress that has come in the wake of this virus.
And at that White House event today honoring nurses, the president called reports detailing shortages of PPE, quote, fake news. But in a whistleblower complaint filed Tuesday by Rick Bright, the vaccination expert fired by the administration, Bright says he warned his superiors about the N95 mask shortage. Now, we should also note that the Pentagon announced a $126 million contract with 3M to make more masks. How is the White House responding to this contradiction?
Well, the president today in the Oval Office, he had a group of nurses. They were there for a Nurses Appreciation Day. And one of the nurses happened to say that she felt that they had a sporadic supply of PPE equipment. And the president really quickly turned around and said that might be the case for you, but he's heard the opposite, that they actually have lots of supplies now. And the president has really tried to shift the blame here from his own administration to the previous administration. He said repeatedly that when they walked into this virus, responding to this virus, they had, quote, empty cupboards, and that they've been having to make up for it. But what we have reported and what we've seen time and time again is that there were high-level government officials who were raising alarms early on, in some cases as early as January. Dr. Bright's one of the top vaccine experts in the federal government, and he said he was sounding the alarm about the lack of supplies that they had months ago. And the government has continued to face criticisms about not having an adequate amount of things like testing supplies, even things to use in the testing, things like pipettes, masks, gloves, and the White House has tried to involve private companies to help get more supplies, but it's been a criticism that they've faced now again and again. And there were alarm bells that we're learning about that were raised in the administration earlier on.
On this topic of PPE, I want to ask about a complaint reportedly filed by the House Oversight Committee alleging a team of volunteers responsible for securing PPE, led by Jared Kushner, lacked relevant experience for the job. It also claims the team ignored the advice of experts, deferring to leads from Trump allies. Meridith, what can you tell us about this complaint?
Well, this complaint is really embarrassing for the efforts of Jared Kushner. He's really been a central figure in trying to orchestrate a response to getting supplies and moving supplies around the country. And what this whistleblower complaint said was that there was a team of volunteers, young people that were brought in from places like private equity firms. Some of them were recent college graduates who were tasked with trying to coordinate some of the ideas and requests that were coming in from the outside to the government. And they were told that they should prioritize ideas or offers for supplies from the president's own allies, which is obviously an issue. And some of those ideas were circulated amongst senior administration officials. But again, this was an embarrassing report to come out. And a lot of critics have said that this shows that while the White House was trying to involve outsiders and involve private companies, they at times were often overlooking many of the resources they had in their own federal government, people with lots of experience trying to organize and get things coordinated in emergency situations. Your long-term government officials at FEMA, people like that were overlooked. Instead, they were taking in and fielding these ideas from all over the place.
Well, Meredith, just as a number of states are starting to reopen, a widely cited model from the University of Washington is now doubling its previous projections of coronavirus-related deaths by August to 134,000. Do we know at this point how closely the White House is actually following that particular model?
Well, this model has been cited since the formation of the task force. It's one that Dr. Birx in particular, she said she's very fond of models and reviewing them and looking at them. And this is really one of the main ones and the important ones in terms of the federal government's response and how they're looking at things. And actually, Dr. Birx was asked about this model today in the Oval Office, and she said that there was a range on the mortality rate that's presented in the model from 60,000 to well over 100,000, as you said, a doubling of the current rate that we have. But these models do change, they do fluctuate, and experts have said this, but these numbers really are staggering, especially as local and state governments are right now trying to grapple with whether or not they should be reopening their economies, and it puts into question how soon and how fast some of these social distancing guidelines that have been pushed by the White House, and the president has said he hopes that we can scale back on soon to get the economy going. It really puts into question how fast some of these leaders should be making that happen.
And Meredith, your colleagues at Politico wrote about conference calls between federal officials where they discussed concerns about reopening and PPE shortages. What more can you tell us about that?
Yeah, my colleagues had a really interesting article that came out, and they were able to obtain recordings from these government conference calls where government officials were talking about some of the issues that they were having behind the scenes and shortages that they had in terms of supplies and different concerns that they had. And it all came just as the White House and President Trump was touting his confidence in things. And again, it shows the disconnect at times that we've seen between the confidence that's been demonstrated by the president and the White House about what we have in terms of supplies and testing, when there are these government officials behind the scenes that have said, we really don't have enough. There's still a lot of unanswered questions, and some of our state and local leaders are coming to us and saying, we don't have what we need to get the job done.
Well, a newly released Monmouth University poll found that 42% of voters say President Trump has done a good job handling the coronavirus outbreak, while 51% say he has done a bad job. Last month, 46% said he was doing a good job, while 49% said he was doing a bad job. Do we know, Meredith, is the president's campaign concerned about these numbers?
Well, the campaign follows closely all of these different polls. This Monmouth poll showed that the president's approval ratings have continued to slide, not only his approval ratings for how he's handled this coronavirus outbreak, but also just his general approval numbers have continued to slide down. But one thing I did think was interesting in there is that while the president's approval ratings have gone down, the approval ratings for governors and for federal health officials continue to remain high. And the White House has really put a lot of responsibility and a lot of pressure on state and local leaders to make some of these hard decisions and to try to orchestrate a lot of the response. So the public opinion there still remains high for some of these people at the state and local level who are making these really tough calls.
Finally, Meredith, I want to ask about your recent piece on how the Trump campaign is attacking Joe Biden over a sexual assault allegation against him. But you note the president appears to be sympathizing with the former vice president. What more can you tell us?
Yeah, my colleague and I, we talked to a lot of the president's allies, people on the campaign. And what we noticed was that there has been this disconnect in the way the president has been handling these allegations made against Joe Biden versus how some of his allies in the campaign have responded to them. The president has been at times almost sympathetic to Joe Biden. He has said that he's faced lots of allegations over the years, and he's also, of course, brought up the treatment that Brett Kavanaugh had in those highly contentious Supreme Court hearings in the summer of 2018, but it's really going to be a delicate dance for the Trump campaign and for Republicans when they're going after Joe Biden. A lot of them have said that there is a little bit of retaliation and retribution here for the way that Brett Kavanaugh was treated years ago, and they think that Joe Biden and these allegations deserve the same amount of scrutiny that we saw during those hearings. But at the same time, they don't want to go too far. And even in their attacks, op-eds, ads, things like that, they haven't said that Biden's guilty, but just that there should be a lot more scrutiny here. And they keep pointing to what they say is the hypocrisy of the media in terms of the coverage and the hypocrisy of Democrats. And I had one senior level person tell me when I was working on this story that something that they're going to be looking out for is how Joe Biden's vice president picks handle this. Biden has said that he wants to nominate a female, and a lot of the women that are at the top of the list had really strong words of defense for Christine Blasey Ford, who was the one who had the most high-profile allegations against Brett Kavanaugh. And so they're going to be, looking very closely at how the Biden team handles this. And while the focus right now really is on coronavirus, I think that this is certainly something that's going to pick up in the coming months as we start looking forward to the general election.
All right, Meridith McGraw, thanks very much. Take care.